Welcome, everybody, to the Beauty and the Beast podcast. I'm Dr. Sal Pacella from San Diego, California. I'm joined, as usual, by my good friend and colleague and co-host, Dr. Sam Jejurikar, who's the president of Dallas Plastic Surgery Institute. Okay, we're going to talk about your favorite subject and my favorite subject, which is plastic surgery and people like us, not plastic surgeons, but men. Okay, so men getting plastic surgery. So this is a topic that is very popular in the media these days and has been, I think, for the last several years. And, there's always been a little bit of a, bit of a controversy in men getting plastic surgery. Should we have it done? Is it poo-pooed? Tell me, Sam, a little bit about it.
Poo-pooed? Sorry. Sorry, I'm not
Let's do that again.
Just all joking aside, Dr. Pacella, I don't think it's controversial. I think there's a stigma, right? Men who get plastic surgery are traditionally not thought to be masculine. It's somehow, there's something about that just goes against what we have traditionally thought in society. So I think when I typically will see a male patient, a lot of times they're much more concerned about hiding the fact that they've had surgery. That being said, the prevalence of men getting plastic surgery is clearly increasing. It used to be that I would see male plastic surgery patients, 1 out of every 25. Now I'd say 1 out of every 3 patients that I see are men getting plastic surgery.
In my practice, traditionally I've seen sort of older gentlemen, professionals, attorneys, corporate guys, and, they feel like they're wearing their age in and around their eyes, in and around their neck. And, they're trying to compete with a younger population of gents coming up, right? And I think that paradigm has shifted quite a bit in the last few years. So now I'm seeing a lot more gentlemen in their 30s and 40s undergoing plastic surgery. What do you feel is the most popular plastic surgery for men in your practice? The most requested?
I have to pick one. If I have to pick one, probably the most common is still liposuction for me. I'll find a lot of guys who are in great physical shape but have some problem areas. And typically we talk about the male triad, where it's the abdomen, the love handles, and then a little bit of gynecomastia or some excessive fat in the chest. That's a very common thing that we will treat with a combination of liposuction and some form of energy, whether it's Vaser to show them some muscle definition or body tight to get a little bit of skin tightening. But it's something that we see very often in our practice. How about you?
Yeah, doing mostly facial surgery, I think by far the most common request from men is blepharoplasty, and that's upper blepharoplasty. That's where we wear the stress of our lives as men, in the upper eyelids, I think. And I think the important thing is really understanding, as we talked about in our previous episodes, is understanding the play of the brow with the upper eyelid. The last thing you want to do in a man is make him look feminized. I hate to use Kenny Rogers, but we'll talk about him. Okay. Yeah. He's got an arch. Barry Manilow is another one, right? So really a big mismatch between their brow and their blepharoplasty. Surgeons have taken female operations and applied them to men. And I think that's a big no-no.
Yeah. I think that's very important. I would agree that above the neck, I see a lot of blephs, I see a lot of neck lifts, and I see a lot of rhinoplasty. But as you're touching upon, a low-set brow in a man is thought to be more masculine. A low-set brow in a woman is thought to be more masculine. And clearly your goals are going to be very different depending on that patient. Talk about your approach to a neck lift in a man versus a neck lift in a woman, or do you do isolated neck lifts in women? How do you approach that?
Yeah. So I think in women, we always want to concentrate on the continuum of the face from the cheek, right? So from the cheek down to the base of the neck. And that always includes the jowl, right? So it's very difficult to isolate the neck from the rest of the face. In women, we don't isolate that. Mm-hmm. In men, we try to do our best to try to pull minimally along the lower face or the mandible. We want a nice, sharp jawline. I like to use the word, your jaw is going to cut glass after this. We want it to be nice and sharp, okay? The thing that I think is challenging in men is hiding that scar. So most of what I'm talking about here is placing an incision behind the ear. In women that wear their hair longer, you can place that and you can hide it very well. So we invariably find ourselves in men putting the incision inside the hairline. I know Dr. Rorik is a big fan of that. He goes inside the hairline as opposed to along the hairline. And to me, that that works very well for somebody who needs minimal to moderate pull. But some of these patients really have a massive amount of skin, a rooster, turkey type of neck. And those are patients that are going to have a challenge in hiding that scar.
Yeah. Kind of following the lines of what you're saying, I think how you design the incision in front of the ear can sometimes vary between men and women as well. In women, when we design the incision in front of the ear, we'll typically duck it behind this little bit of cartilage. If you do that in men, you pull all of their beard hair into their ear. And I know you don't need any more help with that, getting myself as well. But, men in general, we get to the age where we need a neck lift. We don't want the hair from our mid face pulled under our ear. I think the other thing that we have to pay attention to in men is how much we volumize the cheek. So if you look at traditional examples of male facelifts, where we might say they look a little bit more feminine, you alluded to Kenny Rogers.
Well, tell me about Bradley Cooper. He's been in the news lately.
Mm-hmm.
There's been a couple photos of him from 2018 to now. He looks like he's had something. What do you think?
I think he for sure has had an upper eyelid blepharoplasty done for sure. His eyes look more open. I think that there appears to be more volume in the upper portion of his cheek as well. I can't tell if he's had a facelift, but he's clearly had more volume put there as well. And what you'll notice is in social media, people are saying that he looks very different.
Mm-hmm.
And that is the thing. When you add volume to the aging male face, it makes people look very differently than they did before they had the procedure done.
And, some of the subtlety we see in men, so small, this is a perfect example of small procedures or minimizing procedures, I should say, have a big effect. That Bradley Cooper concept is important. And so that sort of goes to less is more in men. Subtlety is king, right?
Mm-hmm. I agree. I like your analogy of telling males that their jaw is going to cut glass. I think I'm probably going to steal that when I talk to patients now. But I think,
I've taught you more than a few things throughout the years. There we go.
Many of which we can repeat on this podcast and many of which we cannot. But I think it illustrates, when I asked you the question before, I don't do isolated neck lifts in women. It's the lower face and the neck must be done. In men, it's really common to do that. You were talking about the challenging male neck where there's a lot of laxity and how do you hide the scar? I'm not a big fan of the operation, but there's even an operation called a TZ plasty, which for male patients that are watching this, if you have some beard hair, there is a school of thought where you can actually just directly excise underneath the neck and hide it in there. You would never do that in a woman. And so the approach has to be different, with men and women, because you have to always maintain those masculine features.
Yeah. So let's go back to that concept of men and doing that TZ plasty.
Mm-hmm.
Okay. So I sometimes talk about that operation to men and sometimes even women too, to be honest with you. And
have you done it in a woman?
I have actually.
You have?
Yeah. And I would say sometimes, you have older patients who have a little bit of extra neck laxity after their facelift. A little mini excision underneath the jawline is going to hide very nicely. Okay. But the concept of scars. So everybody freaks out about that scar.
Mm-hmm.
Okay. So I give this analogy. I say, do you know what the Mona Lisa looks like? Have you ever seen the Mona Lisa? So yes, of course. It's an iconic photograph or an iconic painting. I said, well, do you know what color the frame around the Mona Lisa is? Okay. Do you?
I don't remember there being a frame around the Mona Lisa.
There is. It's kind of like a goldish brown type of thing. We'll confirm that. But
I don't actually think that's true.
And so that frame, no one knows what that frame looks like, right? And that's because that's the periphery of a beautiful painting, right? And so if the center of the face looks great, the eyelids look great, the mouth looks great, the jawline looks great, a little bit of scarring kind of in and around the neckline maybe is not such a bad thing if it's giving you the jawline you like.
Yeah, that's a good line. That's one I'm never going to steal from you because I conceptually disagree with it. But a good line nonetheless.
You need a little more culture in your life, clearly. So
I've seen the Mona Lisa. Don't think there's a frame around it.
Can we confirm that?
Anyways, so that's a good line, Dr. Pacella. Not one I'm ever going to steal from you. Because regardless of whether or not the Mona Lisa has a frame, imagine that the Mona Lisa had a bright neon frame around it with flashing lights that distracted from the picture. A bad scar underneath the neck that's visible can accomplish that exact same
Do
thing.
your scars look like that?
I don't what?
Do your scars look red and neon like?
I've
No.
seen TZ plasty scars in patients. Not, I don't really like the operation, but I've seen them coming in for secondary consults with me that have healed very poorly.
Okay. How often do you do that operation in men?
I've done it about 3 times, and man, it's not my favorite operation.
Yeah, it's not very popular. I'd say about 10 times in my career, but
Yeah.
I've been very happy with the results.
Yeah.
So let's shift gears a little bit. Let's talk about another very popular procedure in men. That's hair restoration. Very popular in your practice. Who gets it? What's the process like?
So hair transplantation is something that we do in our practice. It is quite popular. It's amazing how much money men are willing to spend on hair. And I think if you watch TV or, look at your ads coming across your feed, the amount of things you see for himandhers.com for hair restoration is pretty substantial. It's a huge billion-dollar industry. I don't think we should start off with hair with hair transplants in men. We start off with things like topical finasteride and minoxidil. But for patients that have bald patches, okay, not patients with thinning hair, but patients with bald patches, hair transplantation is really the only option. It used to be that your only option in hair transplantation was doing what was called a strip, where people would get an incision that goes across the back of their head. You would harvest the hair from there and put in these individual, plugs, which looked really bad. And then it went down to individual grafts, which look better. Now we can do what's called follicular unit extraction. So you don't need a scar. Patient's awake the whole time. It's a long day. It's, 8 hours worth but you can put in 2,000, 2,500 grafts, which can go a long way to fill in pretty substantial bald patches. I'll always tell patients that in your lifetime, you have enough hair on the back of your head, which is where we take it from, for about 3 operations of about 2,000 grafts. So we try to ration the hair to make that work.
Yeah, little story. So back in the spring, I was invited to give a eyelid talk in Istanbul, and I was coming back from Istanbul to LAX, and I could count on both hands how many guys were coming from Istanbul to Los Angeles with wraps on their head, getting hair transplants.
That's
very
remarkable.
popular there, affordable there. So, but,
Very much so.
yeah. So,
Yeah.
well, this has been a great topic, something that Dr. Sam and I are very much interested in, and maybe someday we'll engage as patients our own. We'll see. What do you think?
I think that day will happen sooner than we think. So,
Any takeaway points?
yeah, I think the biggest thing is male plastic surgery is really common. There are key differences in terms of how a male operation should end up versus a female. So make sure you go to someone that does plenty of male patients.
Well, once again, thanks for attending the Beauty and the Beast podcast.
Cheers.